afternoon, good morning, good evening to people all over the globe, wherever you are, and even if you're watching us recorded. Firstly, as Ina has asked, can everyone please keep their microphones on mute until later on? If you've got questions which suddenly come to mind whilst Dr. Martha is talking, put them in the chat and we will then bring them up afterwards. We'll go from there. So first of all, I'm going to say, Dr. Martha, welcome. You're well known. Unlike me, you are famous as opposed to my notoriety. But you actually, what you're going to do today is a bit of a parody of another polio survivor's song, Joni Mitchell. I look at life from both sides now. You're going to actually talk about how to talk to doctors. And as a polio survivor and a doctor, you are uniquely placed to educate us as to what we should be doing and how we should be approaching our medical colleagues and carers. So over to you, Martha. You're still on mute.
Yeah, good morning. Who's going Ken, who's going to project the PowerPoint? Do you want to do it or do you want me to do it? Okay, perfect. Thank you very much. Well, good morning, everybody. My name is Martha Castilleja, and today we are going to talk about the importance of working with our doctor when we have post-polio syndrome, PPS. Next, please. I am a polio survivor, also a retired Mexican medical doctor, and proudly a Rotary Club member. I'm a new member now. My story starts in 1952 in Mexico City when I was 1 year old, amid the worst epidemic that we have of poliomyelitis in the Americas. Just 4 years before the vaccines came into commercial use. In 1956, the Salk vaccine. In 1962, the saving one. Next, please. Are you a polio survivor, or do you know a polio survivor who's dealing with PPS? The sooner we see a doctor and start the dialogue, the better. Remember, the early interventions always improve the condition's prognosis. Thank you. Next one, please. Some polio survivors may wonder, why to see a doctor to treat my PPS? Why, if many of them do not understand, know, or even think that PPS even exists? This concern is partially reasonable. Not all doctors are familiar with PPS. However, there are many healthcare providers who can help us. Several interventions can be done to improve our quality of life. I encourage you to, 1, advocate for yourself. Make sure the doctor is aware of PPS. 2, have a kind, honest, productive discussion with them. And 3, work closely with your healthcare team in managing PPS to ensure that you receive the best care possible. If they say, well, actually, you know, PPS is only a theory, it doesn't exist, it's just the aging process. And you, with a very kind voice, you can tell your doctor, the proof that PPS exists is that the maximum authority in health in the World Health Organization, gave it already a code in the International Classification of Diseases ICD-10, and the PPS code is G14. So it exists, and any doctor is going to understand that classification. Thank you. Next one, please. In order for us to be all in the same page, let me share with you the PPS definition and general information. Post-polio syndrome is a neurological disorder that affects polio survivors many years, like 10 to 40 years after they recover from the acute illness of poliomyelitis. It is not contagious. PPS is believed to be the result of a deterioration of motor neurons over many years. We see loss of muscle strength and dysfunction. According to the CDC, PPS affects between 25 and 40% of polio survivors. There are 300,000 polio survivors in the US, and 25 to 50% of them may develop some degree of post-polio syndrome. According to the World Health Organization, there are more than 1 million polio survivors in the world. In severe cases, symptoms may mimic those of the rare disorder known as Lou Gehrig disease, amyotrophic lateral sclerosis, ALS. And it's important to rule out, because PPS is a diagnosis of exclusion. There is not a specific test that is going to tell us for sure it is PPS. So the diagnosis is made from the clinical point of view with a very detailed clinical history, and we have to rule out other problems, other conditions, and there are many. According to Mayo Clinic, there are more than 25 disorders that mimic post-polio syndrome. So try to find the right doctor for that. PPS is rarely life-threatening, but it can interfere with the activities of daily living, and also it deteriorates our quality of life. Next, please. Also, in order to be in the same page, I'm going to review, to make a summary of the pathophysiology. You can share this diagram with your doctors. I don't know if you see my cursor, but here, the first one is the normal situation. This is the motor neuron. This is the muscle fiber. Everything is healthy here. What happens in the second one? The infected neuron by the poliovirus, and the motor neurons die because of the poliovirus. What happens then? The surviving motor neurons sprout out and adopt the neighbors, the orphan muscle fibers. So they sprout out and adopt the muscles. That is why we see after the acute polio, we see kind of recovery. That recovery is not other thing but the motor neurons, the surviving motor neurons, extending the branches and adopting the orphan muscle fibers. In the post-polio syndrome, at the beginning, in the early stage, we don't see many situations, we don't see many problems, we just see that it was a recovery. But with the years, 10, 40 years after the acute polio situation, we see that the motor neurons who adopted the muscle fibers get tired and start detaching. The survivor motor neurons detach the adopted muscle fibers. This is called the second denervation, and that is exactly the PPS. And this is the pathophysiology. Pathophysiology is the way that PPS acts, you know, and it's a second denervation. What happens? They detach from the muscles. This model is it's a model called adoption. It's an analogy. Yeah, the next one, please. Yeah, also for us to be in the same page, let me tell you briefly the risk factors that increase your risk of developing PPS. First of all, the severity of initial polio infection. The more severe the initial infection, the more likely that we will have signs and symptoms of PPS. Second, age of onset of initial illness. If you develop polio as an adolescent or adult rather than as a child, your chances of developing post-polio syndrome increase. Third, recovery. The greater your recovery after acute polio, the more likely it seems that post-polio syndrome will develop. This may be because greater recovery places additional stress on motor neurons. That means that during the recovery process, a lot of motor neurons sprout out, and obviously they adopted several muscle fibers, and they are going to get tired sooner. And the fourth one is excessive physical activity. If you often exercise to the point of exhaustion or fatigue, you might overwork already stressed out motor neurons and increase your risk of post-polio syndrome. This situation is very important because many polio survivors think, okay, I'm going to exercise, I'm going to swim 2 hours. Guess what? We're killing the surviving motor neurons, and we are accelerating the detaching process. Thank you. Next one, please. Okay, well, I'm going to tell you some tips to help to get the most out of your medical appointment. This is not written on stone. You may have better ideas, and I will be more than happy to receive your ideas. Next one, please. This is a summary, and I'm going to go over each one later. Number one, educate yourself about PPS. Number two, find the right doctor. 3, list your specific symptoms. 4, keep a record of your medical history. 5, make a list of all your medications. 6, ask questions. Talk about treatment options, lifestyle modifications, and how to manage your symptoms. 7, inform your doctor about your daily routine, limitations you face, and how PPS affects your quality of life. Also, ask your doctor about therapies, physical therapy, occupational therapy, assisted devices, aquatic therapy, pain management, medication options. In my case, I have seen that what helps me the most is aquatic therapy, even more than walking. I try to walk 1 hour per day. Sometimes it's too much, but aquatic therapy, every time that I go to the swimming pool, I feel excellent that day and the next day. I'm not going to be swimming. I'm not going to be killing my motor neurons. I just go inside the swimming pool. The water has to be to the level of here, just the neck. The pressure of water on my chest improves my cardiovascular function and my pulmonary function. And what I do is I open my arms like this with thumbs up. I close and out, close and out. 1 hour. Then the legs moving, just moving softly. Very, very easy. And that helps a lot because then you don't lose muscle mass and you don't kill your motor neurons. Number 8, ask your doctor about therapies. I said that already. Okay. 9, discuss lifestyle modifications. How much exercise? How much should I rest? How do I manage my stress? What kind of diet can I take? And here, it is very important. If you are overweight or you are obese, the best thing you can do for your post-polio syndrome to improve your well-being is lose weight. As soon as you lose weight, then the motor neurons work better. So it's a very respectful advice. And the last one is exactly the same as the first one. Keep on educating yourself about PPS, and we are going to go now one by one. Next, please. Okay, tip number 1, educate yourself about PPS. Search information from trustful sources. Please do not Google or YouTube search. Be specific. Some of the trustful sources are World Health Organization, where is my cursor? World Health Organization, March of Dimes, Polio Australia. Polio Australia is doing a wonderful, wonderful job. Centers for Disease Control and Prevention, Post-Polio Health International, World Health Organization, and support groups. They could be in person or it could be by Zoom, and you can have a large and very comprehensive list of support groups, thanks to our friend Maureen, who's the leader of the Boca Area Post-Polio Group. She can send you a comprehensive list. She can email it to you upon request, or I can do it. You can get support groups all over the world in many, many languages. We are trying to start a support group meeting in Spanish. I hope to have it ready this week. This year. Thank you. Next, please. Yeah, you have here the websites. You have here the websites. Go to these websites. Next, please. I'm sorry.
1 second. I got out of somehow. I got out of this. So give me 1 second, and I'll get back in here again. Okay. Okay. Try this. Okay, next. There we go.
Okay, support groups, either in person or virtual. Support groups are vital and probably the most important resource to remain connected with our polio community. Next, please. Mayo Clinic offers a list of support group benefits. The main one is feeling less lonely, isolated, or judged, reducing distress, depression, anxiety, or fatigue, talking openly and honestly about your feelings, improving skills to cope with challenges, staying motivated to manage chronic condition, or stick to treatment plans, gaining a sense of empowerment, control, or hope, improving understanding of a disease and your own experience with this, getting practical feedback about treatment options, learning about your condition and social resources, socialize with peers. Next, please. The tip number 2 is find the right doctor. We need to ask openly in a very respectful way. We need to ask doctors if they have treated PPS patients, and we are going to check their reviews. We can also talk to polio fellows. We can ask them, are you receiving good treatment? Do you have a doctor who knows about PPS? Maybe they can recommend somebody. Attend polio support groups, visit trustful websites on the internet. When you get the right doctor, this is what I have done. It's a very personal opinion. What I have done, and I know that he or she knows about PPS, I try to invite them to participate in conference, to participate in support group, to educate themselves with YouTube, specific YouTube podcasts, or to invite him or her to the team. Okay, next, please. We are going to have a list of our specific signs and symptoms. We need to know that the most common include generalized fatigue. It's a specific fatigue we didn't feel in the past. We have muscle and joint new weakness and pain that get worse over time. In my case, I only have fatigue and weakness. For now, I have not had pain. Also, another sign is fasciculations. Fasciculation is a brief, spontaneous contraction affecting a small group of muscle fibers. Fasciculation are also called twitches. I remember one of my first signs of post-polio syndrome was fasciculations. I was affected only from the right leg, so my right leg is totally paralyzed. I use a brace for most of my life, and I only have two movements. I only had two movements: the big toe and the gluteal muscle. I was able to contract my gluteal muscle all my life and relax. Suddenly, like, I don't know, probably 6 years ago, I contracted my muscle, my gluteal muscle, and guess what happened? Fasciculations. I contracted and then the twitches like this. That was a sign. And then I immediately said, oh, this is post-polio. In case it was your arm, the limb that was affected, you can see, you can contract your bicep and then relax. If it contracts and relaxes, that's fine. But if it contracts and then during the contraction, then the twitches start, it could be motor neuron problem. Because actually the fasciculations is the typical sign that the motor neurons are disconnecting. There are other less common symptoms and signs. Decreased tolerance of cold temperatures, breathing difficulties, swallowing problems, sleep-related breathing problems. Next one, please. Tip number 4, keep a record of your medical history. Ask your relatives, ask people who saw you when you got polio. Sometimes it's a taboo. I remember somebody told me that you were vaccinated, your mother took you to be vaccinated. Why? How? It was not vaccine in 1952. So let's keep a record of a medical history. Try to have all the information. Ask people, remember what you felt when you were a little girl, and do your best to keep a record of medical history. Thank you very much. Next tip number 5. Make a list of your medications, doses, and frequency. Include vitamins, herbal medications that you buy over the counter, everything. Next, please. Tip number 6, ask questions, treatment options, lifestyle modifications, and how to manage your symptoms. Next one, please. Inform about your daily routine, the limitations you face, and how PPS affects your quality of life. Don't be shy. Talk openly. Do you feel depressed? What are you feeling? Because there are many interventions we can have to improve our quality of life. Quality of life means a lot. We need to talk about the material living condition. What do we do? What do we do to like a hobby? Do we have another conditions that make us, for example, hypothyroidism, depression, obesity, cardiovascular problems, etc. You need to give all the information to your doctor, because what we need now is quality of life. We polio people are still here, and we deserve quality of life. Next one, please. When you ask about therapies, think about referrals for physical therapy, occupational therapy, assistive devices. Sometimes the insurance pays for assistive devices. Aquatic therapy. Baptist Hospital has a wonderful program for aquatic therapy. Pain management. There are clinics for pain and medication options. There are some interventions we can have. Next one, please. Discuss in a detailed way lifestyle modifications, because sometimes we are doing the wrong thing, having a lot of rest, which is not healthy, or a lot of exercise that is not healthy. We are not sleeping well, and we do not talk about that. Let's discuss every detail. And give this presentation to your doctors. Print it out. I can send it to you. print it out, educate the nurses, the therapists, the doctors, everybody needs to be educated about PPS because we are still a lot of people, polio survivors with PPS. Next one, please. And I'm going to repeat myself, I'm sorry. The relationship doctor-patient has to be good. It's vital for you to get the best treatment, for you to receive the most adequate intervention to keep your motor neurons alive for many, many years and to have quality of life. Next one, please. I wrote this book. The name of this book is astrocyta. The astrocytes are cells from the brain. That is why I chose this name. It's a bilingual book of science for children, and it is sold in Amazon. My main character, this motor neuron called astrocyte, it's a female astrocyte. She tells the stories about the most basic bodily functions. All the royalties are donated to the Post-Polio Mexico organization. Sometimes I donate $0, sometimes I donate $14. My record is, it was in December last year, $74. So I'm trying to promote this because Post-Polio group in Mexico needs support. And guess what? It's a very fun book. You're going to like it. I'm very, very sure. Next one, please. This is my favorite character of my book. It's a motor neuron. This is a motor neuron, you know, with the outsprout, the ramification, the branches, holding on the fiber, the muscle fiber, to do the movements. This is my motor neuron in the book. And I close this presentation with a thought that embodies what I believe. How a society treats its people with disabilities is the true measure of a civilization. These are words of a contemporary Chinese civil rights activist, Chen Wancheng. Next one, please. And that's it. Thank you very much. Aside from the time,
Why I'm hearing such an annoying accent.
Right. Yeah, she's not.
Dr. Martha, I regret to say that about 10 minutes into your presentation, all my power went out. So my computer closed down and everything else. I've only just got back in and joined it again in the last 20 minutes, for which I apologize. You know, things do happen. I've been looking at, but I've been able to look at the chat and going through from there. Your astrocyta book is available in Europe as well. I've just checked.
yes,
If you
Amazon.
on Amazon, yes. But if you want the hardback edition, it'll cost you the equivalent in Europe of $50. Rather expensive, but there we go. And also for support groups in Europe, there is a whole list on the website, which is in the chat, which is www.europeanpolio.eu. Right now, who has got any questions
Or comments?
or comments? Yes.
Carla.
Here we go. Jenny,
There. Oh,
unmute yourself and talk
Well,
away, and then we'll
thank
go on
you.
to Green after
Thank you,
that.
Martha. Those are great.
Great presentation. I love it.
It is a help if you
I have
can
one question
do
for
your
you.
pills.
Okay,
And
I will try to remember.
Sorry.
Last night I was a little bit tired. And
Who are we talking to here?
I have no idea. Anyway, can I talk?
Yes, please.
So my question is, I'm on this exercise kick. I have my right leg is affected, so I try not to exercise my right leg. But what do you think of other cardiovascular exercise, like using a hand crank or swimming in a swimming pool or something? Is that a good idea?
Cardiovascular exercises is a very, very good idea as long as you do not move a lot
Right.
your limbs, you know, because you don't know. For example, I always thought that it was only my right leg affected. Guess what? I found out that it was also the other leg, and it was also my arms a little bit. So take it easy. Take it easy and have your cardiovascular exercise, but take it easy with your limbs.
I do it with my arms.
Mm-hmm.
Carla, you're next up.
My question is, if and when you get the support group started in Mexico, are you at all interested in having some of the Spanish-speaking people who are in our U.S. support groups join you?
Yes. We're trying to invite everybody to speak Spanish.
Okay, so Central, South America, and those in the U.S. who were raised primary Spanish speakers with polio.
Yeah. I'm going to write
Great.
email. I'm going to write my email and my telephone. My email is better. So if you have information about polio speaking people, just send it to me.
There are a lot in California, both in Northern and Southern California, who were primary Spanish speakers. So
Beautiful.
Maureen, you're up next.
Thank you. We both have questions. First of all, on the wonderful presentation, I even learned a few things that I didn't know. So one of the things that struck me in one of your slides, you said recovery. The greater your recovery after acute polio, the more likely it seems that post-polio syndrome will develop. This may be because greater recovery places additional stress on motor neurons. So if I'm guessing, if somebody never left braces like myself and you perhaps, would that mean you have less chance of getting PPS as opposed to people who were totally paralyzed and then all of a sudden they made a dramatic recovery where they became a passer, where to look at them, you know, nothing is wrong with them. You wouldn't know that they had polio.
Well, let me answer in two parts. First of all, the recovery is motor neurons outsprouting. That is the recovery.
Mm-hmm.
And that outsprouting is going to be detached sooner or later. So that is why the more recovery is in higher risk, because it's more sprouting, more outsprouting. That is one thing. The other thing, people using braces like me, you know, I had polio at 1 year old, and then my little brace was like this, and as of today, I still have the brace in my right leg. I am protecting that leg with my brace, you know? I have a friend in Mexico who said, I'm not going to wear braces. And he was walking and walking and walking without the brace. Guess what? Cannot move now because of post-polio syndrome. It's only one case, but it's in the literature. If you have braces, you are more protected.
So
Did I answer your question?
we can talk later, Martha. But thank you so much. Joel has a question as well.
Martha,
Thank you.
I might have missed it in the discussion, but I noticed something that when someone says, well, how are you doing? And I say, well, I'm doing pretty good. Look at here. And when I pull this muscle up, for example, like it just did, it contracts to a little bit of a spasm. It locks up into that position, and I got to move it around a little bit to get it. What is that? Is that post-polio?
No, I don't think so. I don't think so. It's the contraction and it stays contracted. Yes. It's not fasciculation. Fasciculation is disconnection.
Okay, thank you.
Thank you, Martha.
Thank you.
Diane, you're next.
Good evening, Martha. Ganesh here from India.
Hi, Ganesh.
Hi. My question is towards the appropriate bracing context to the post-polio. How important it is to evaluate the muscle positioning to have the appropriate braces in terms of the weight also. Presently, I am using Becker joint, which appears to be a little on the heavier side, all the more leading to the muscle weakness.
Wow, guess what? I didn't understand the question. Do you think you can write it in the chat?
Okay.
Or somebody could help me to understand the question?
Ganesh, can you repeat your question?
My question is towards the bracing. How important it is to evaluate frequently the muscle condition for an appropriate bracing?
Evaluate.
Okay, Martha, the question, you got the question now? It's about evaluation. How often do you need to reevaluate the bracing of a leg? How often do you have to go and see your orthotist to see about getting your brace replaced, renewed, or altered?
At least once per year, at least. You know, we shouldn't wait more than 1 year. No? Unless somebody has another opinion, but I think no more than 1 year. Every year, an evaluation every year. I'm talking only about the brace. If something happens, lose weight or any other situation, then is less than 1 year, but at least once per year.
My personal experience is that with a lightweight brace, with a good durability, helps one to have a good endurance.
I hear a lot of noise.
So do I.
I'm taking care of it, I think. I think you're all right now.
Am I audible?
You're talking about lightweight braces, are you, Ganesh?
Lightweight braces to have a good endurance with a good durability. Hello.
I'm not understanding. I'm very, very sorry.
See, I'm having my personal experience towards lightweight brace for a good endurance. I feel that if the braces can be on the lighter side with a good durability, it will help all the more to improve endurance.
Yeah. What it is, Ganesh is saying that he feels that if you have a lightweight brace, such as the plastic type or the flexible types, they will be better for you. And he's asking your opinion on it.
Actually, I'm not an expert on that. I was using a brace that I thought it was a very good brace, but then somebody asked, tell me to make some improvements, and then I realized that I was not using the right brace. You know who knows more about braces? Maureen.
I could respond as well. I'm a retired
Thank you,
PT. And if the brace is made by an orthotist who knows how to brace polios, which is, again, part of the medical group that you need to have totally on your side, that lightweight brace, if it doesn't have too much torsion in the in it, will probably work well, but it really should have almost no torsion in it, because that will displace how your foot, your ankle, your knee, and your hips work on up the chain. So you really need an excellent
Brace maker.
orthotist.
Yeah.
And
It
those are kind of,
it becomes all the more important to have an expert for post-polio survivors towards the
absolutely.
bracing.
Ganesh, if you can send me your email at PPSadvocacy@gmail.com, I will actually get you in touch with somebody who can give you the definitive answers over and above the excellent one that Carl has given.
Sure.
Okay. Diane, you've been very patient. Please unmute yourself and ask your question.
I had a doctor. I wanted to exercise a lot, Martha, and my physiatrist said, Diane, please do yourself a favor and start a journal. And if you exercise, say 20 minutes, then lay down and time your laying down and time how long does it take for your body to tell you you're fine, you can get up and move. Because if it's growing, if the lay down and the rest after an exercise is increasing compared to the time that you exercised, then your post-polio is increasing.
Mm-hmm.
So did you find that's a pretty good judge of it?
Yeah, I think it's a good advice. Yeah. Is your doctor in Florida?
Yes, but he had to close his outpatient. He treated me for 26 years, but we're personal friends now after all those years. But so I do run things by him, but he can't treat except if you're in the hospital, he can. Which I don't want to be in the hospital.
No.
And would you like to come in and ask your question or make your comments?
Yes, thank you. I had always been a swimmer and I loved it. More recently, the past 3 or 4 years, I've been working with a personal trainer and he's been using weights. I've been doing weights and I'm finding that I'm feeling better. Now, we work maybe a half an hour or so. The weights, we do go up in terms of, the weight of the weights. How do you feel about that? I'm feeling better doing this weight work.
And I'm very glad that you feel better, but I read that it's not a good idea to use weights. It's just to be inside the water and move your body inside the water without weight. I read it, but if you are feeling well, you'll talk to your doctor. But I read that it's better not to use weights because it is not a physiological situation.
Okay, I will take that certainly under advisement. Thank you very much.
Thank you, Anne.
Maureen, you want to come back in again?
Yes, please. My husband has a suggestion here.
I'm interrupting for only one reason. In Zooms, we depend upon the fidelity of our equipment, and the weakest link in stereo is bass. So if a man has a strong voice and a bass voice, you can understand little or nothing. If you take the treble and turn it all the way up and the bass a little down, all of a sudden, everything will become clear because that's where the ears are more friendly to treble, not bass. So if that can be a help to you, we just did it and we understand Martha perfectly now. And I should have known better. But as soon as we changed it, everybody's voice, including the bass voice that we had a moment ago that's so beautiful,
Ganesh.
it just got clear as a bell. So if that suggestion helps you, please.
Thank you, John.
We've actually just hit the hour. We're just on the hour, which is unusual. And I'm sure there's lots and lots more questions to go through and lots more comments. There is a comment here, which I think you ought to have seen. Can you see it, Martha?
Where is she? See this girl here?
There's a comment here saying, disagree with Dr. Martha about her response to Maureen's husband, muscle cramping and spasms with use of affected body parts. I have PPS symptoms all over my body. I frequently have muscle cramping and spasms, both with use and sometimes when at rest. They are painful and decrease my function.
Well, what I think, I take this with a lot of respect. The contraction without pain, I don't see any problem. But if the contraction is painful, that's another story.
Mm-hmm.
Thank you, Francis Lopez.
Mm-hmm. How do we have any more, John, or should we begin to close it?
There's no more in the chat.
Okay.
I'm sure there'll be lots of questions afterwards. If you have questions which come to you afterwards, please send them to ppsadvocacy@gmail.com and I will pass them on to Dr. Martha.
John, there was a question asking about that code for the World.
He put it in the chat. All the codes are in the chat now.
Okay, good. Okay, excellent.
Yeah. It's in ICD 10 14 ICD 11 8B62.
Great.
There was also a question about Pilates from Harriet.
I honestly don't know anything about Pilates.
It's a fabulous program, and it's very, very easy to overdo.
Very. It doesn't feel like you're hurting yourself very much, and yet it's exhausting. Yeah. So, Dr. Martha, I cannot thank you enough. This is exactly what we dream of, is having somebody like you who is on both sides now. And it means the world. I took so many notes today because when I do my speaking to Rotarians, I now am armed with so much more information when they ask me the questions, and I always will reference how much I learned from you today. A lot of what we talk about, as you can see, is that people really need support. They have a lot of questions. And the fact that they'll ask about bracing or they will ask about exercise means that they don't have a big enough medical support team that they need to go to and ask those very questions and get the answers that they need. And we like to stand in that spot, but we also want them to advocate for themselves and get the answers that they need. So I want to thank everybody for joining us today. It was an extraordinary experience, and I can't thank you enough, Dr. Martha, and I also can't thank Ken enough for making this happen today, because he's the magic man. Everybody good? All right, thank you. Thank you again. If we could give you a standing ovation, we would, but I can't stand up. Okay.